Hey y'all, this video is for anybody that is learning how to put contact lenses in their eyes for the first time. I understand this can be a super stressful time for most people because it's just not a natural thing to touch your eye and put something in there. It can take a long time when you're first learning how to do this. And so I'm going to give you some tips and pointers to help make this as easy as possible so that you don't spend hours learning how to do this and stressing out and just getting frustrated with it. If you follow these steps, I promise it will make things much easier on you. Now, a little piece of advice first. I don't recommend anybody try to do this by themselves for the first time. We always require all of our patients to come in for a 1-hour training session when they're first learning how to do contacts. And that should be something you should have already done if you're watching this video, or you should at least have it scheduled. So you want to be doing this under the supervision of your eye doctor for the first time or two so that you're not going to scratch your eye, you're not going to hurt yourself, and you learn how to put them in correctly and also learn how to take them out correctly. So hopefully you've already done that. And this video is more for if you're having some trouble and you just want to troubleshoot this and you didn't quite get it when you were at the doctor's office, or you just are trying to learn about it before you go. Maybe this will help you learn some about that. So let's dive in and pay attention, and I'll promise I'll make this super easy for you. All right, the first step anybody should do is to wash your hands thoroughly with soap and water. Make sure you get anything that's stuck on your fingertips off your fingertips. Make sure they're nice and clean, because the last thing you want to do is get something on those contacts before you put them in your eyes. You always want to make sure you dry your hands with a good paper towel or something that's lint free, because you can get little pieces of lint off of things like tissues that can get on the tip of your fingers, and it can get on that contact lens, and it can cause all kinds of discomfort if you put that in your eye. So always use a regular paper towel to dry your hands. The next step is to take the contact lens out of the pack. So typically they come in these little flat packs like this, and they're down in this solution. So you're going to use your pointer finger on your dominant hand and just put your finger down into the solution, and typically it's going to stick to the back of your finger. And the next thing you want to do is to pick it up with your other hand using your thumb and your pointer finger, and squeeze it between there very gently, and then you are going to set it upright on your fingertip. And after you do that, you want to inspect the lens to make sure that it's not inside out, and make sure that it doesn't have any tears or anything like that in it, because you do not want to put it in your eye if it has any tears. So the way you can tell it's inside out is by doing the taco test. So if you take it and you roll the edges inward, the lens should roll in like a taco. If the lens is inside out, let me flip it inside out here, and you try to roll it in, you'll notice the edges of it don't seem to completely connect in there like it would on a taco shell. So one thing you can tell, if it's hard for you to be able to see this, if you put it in your eyes and it feels like it just doesn't ever settle into place correctly, and it just doesn't feel like it's fitting right, it's likely inside out. So in that case, I just recommend go ahead and take it out, flip it around, and put it back in. Okay, so now that we have it taken out of the solution and it's on our index finger here, this is the most important step that most people get wrong. So pay really close attention here. You need to make sure your eyelids are nice and wide, because if you don't have your lids wide enough, the contact lens is going to graze against your eyelashes or your eyelid before it goes in your eye, and it's going to flatten out on your fingertip, and it's not going to go in your eye. So please, please, please pay close attention to this step right here. So it works best if you use both hands for this. So you're going to have the contact lens on your dominant hand on the pointer finger, and you are going to use the middle finger of your dominant hand to pull your lower eyelid down. And then you're going to come around with your non-dominant hand, and you're going to pull your upper eyelid up like this. And then you're going to put the contact lens on just like that. So a common thing that I see with people, and this is something that they do wrong, is that when they're holding their eyelids up, they don't grab it in the right place. So they pull it apart like this, and it looks like it's nice and wide, but then when they go to put the contact lens in there, their eye just closes automatically. So it gets narrower because their body is trying to react like, we don't want this thing in our eyes. So what you need to do is make sure you put your finger right where your eyelashes are. So if you grab it right where the lashes are on the upper and the lower lid and pull it down just a little bit against the bone of your orbit, the lids will stay apart. And see, I'm trying to blink, but they just stay apart. And I'm not putting a lot of force on my eyes to do this. Whereas if I do this, I'm having to pull a lot and it's kind of hurting, and I can still blink through it and I can knock that contact lens off. So pay close attention and try to make sure you get that step right every single time. Now that you have your lids open nice and wide, you're ready to put the lens in there. Now, one last thing I'll explain is you want to make sure it's up on the fingertip like this, and get your lids open nice and wide again. And all you have to do is very gently touch your eye with the contact lens and then pull your finger away and blink. And it's in my eye. That's all you have to do. One common thing I see people do is when they try to put it in, they push too hard. And so they end up pushing it really hard onto their eyeball, and it flattens the lens out and it won't go in. Sometimes people do everything right and that contact lens just wants to stick to their finger. If that keeps happening to you, it helps if you get a paper towel and dry the tip of your finger underneath the contact lens before you put it in there. And sometimes that helps keep it from sticking to your finger. But once it's in there, that's all you have to do, and you just switch to the other eye and repeat the process. Now, some people are not very good switching hands, so if you're really right-handed and you're going to your left eye, it's okay to come around and do the same technique to the left eye with your right hand, but it works better for me if I use my left hand and pull the lower lid down and put it in like that with my left hand. But like I said, you can do that either way. Just do what feels best to you in terms of that. So that's really all it takes. If you follow those steps just like I mentioned, you shouldn't have any trouble. Now, I see people do this all kinds of different ways, and whatever works for you, do it. But this seems to be, I would say 80 or 90% of my patient population, this technique works the best for them. So try this first. If this isn't working, maybe go into something else. One thing that does help some people is instead of using two hands, they just use one hand. So they put the contact back on their index finger and they use their middle finger to pull their lower eyelid down. And when they do that, you just pull the lower lid down and look up. And this gets the upper lid out of the way a little bit. And then you just touch your eye with the contact like that. That's actually how I do it most days. But I've been doing this since I was about 10 years old. So it comes pretty naturally to me. But one thing, when you put the contacts in, they should feel pretty comfortable right away. If they're painful or something just doesn't feel right, then it's likely that the contact lens has something underneath it, or it even may have a tear in it, or it just didn't go in your eye correctly. So in that case, you need to take it out and put it back in, and it should feel pretty good. You may know it's in there for the first couple of minutes, but it shouldn't be painful. It shouldn't hurt. And if something keeps happening and it just keeps hurting, then you need to check back in with your doctor and see what's going on with that. Because contact lenses, once they go in, you should be able to wear them most of the day and not realize they're in there. And some people are more sensitive. They have drier eyes and they need to use other types of lenses that are more moist or things like that. So check with your doctor. It's like a pair of shoes. Everybody likes different shoes. They fit everybody differently, and you just got to find that one that fits the best. But let me know what you think about this. If you have any questions, if there's other techniques that you think work better, I'm open to hearing them. So hopefully you enjoyed this. Hopefully this made putting contact lenses a little bit easier for you. And hopefully you are a pro at this by now and you're not having to get up super early in the morning and stressing out about it. So y'all have a good rest of your day. Thanks for watching.